All right, good morning, everybody. Thank you for joining us on our third edition of this Quarantine 101. My name is Dr. Markle, and today we're going to switch up topics a little bit. The first two topics were more generalized, looking at immunity as well as some overall posture. Today was inspired by a patient I saw last week. It was a 25-year-old rugby player who tore his ACL, and with all the elective non-critical surgeries being postponed, unfortunately his surgeon said, well, he can't do his surgery until like August or September, which he tore it like 6 weeks ago, so that's a long time to go. But the biggest thing is the therapist or the orthopedic didn't offer him any physical therapy or any other options for him, just to deal with it. Here's a brace. So I thought it would be a good idea to have a talk about one, ACL tears in general, the importance of them, and why the importance of your ACL, as well as maybe some non-surgical options we offer. In addition, highlighting some critical key factors in rehabilitation aspects and really working with a good therapist and the importance of that. So today we have Dr. James Westover on to talk about some of his great things he's doing. He's a chiropractor. We'll introduce him, as well as we have a guest who, one of our patients, I treated her ACL tear non-surgically, as well as Jimmy had helped with some of the rehabilitation stuff, which was critical. So we'll get her perspective on everything as well. So for those knowing that our clinic and anybody in Colorado right now, we're at that phase 2 of the transition back to a normal lifestyle. Here in Colorado, we have been opened up for elective procedures that are non-hospital based, so anything in the office. Luckily, we're a standalone clinic, so we've actually started treating patients again, seeing patients in office. But we still have the option to do some of the telemedicine stuff as well as Dr. Westover. So patients are still fearful of coming into the office. We have that option available. And just give a heads up, so anybody listening to this, long-term wise, even if you've listened to this after the fact, I'm offering a free MRI review of any ACL tears or any other conditions. If you have any questions whether or not you're a candidate for what we do, you can always send your MRI to us. You can email me directly, and then we can have you upload some imaging, and I can look at the imaging and let you know if we basically can have a talk after that. Just see what your MRI is showing and if there's an option for a non-surgical option. So for those of you who don't know me, my name is Dr. Markle. I'm one of the interventional orthopedic physicians here at Centeno Schultz Clinic. I'm board certified in physical medicine rehab, which is a non-surgical sports medicine, sports and spine specialty. Then I did some fellowship training in interventional orthopedics, and that's more of becoming an expert in orthobiologics. So at this point, I continue to publish research and update literature on stem cells, PRP, treatments for certain conditions, whether it be your spine condition or a joint condition. I'm also one of the main instructors for a nonprofit called Interventional Orthopedic Foundation or Interventional Orthobiologic Foundation. And I also give lectures both domestically and internationally on stem cells and PRP treatments. My next one will be out of the country in Dubai in a few months. And I'm not only one of the physicians here, I'm also one of the patients, because I also live a pretty active lifestyle. Being in Colorado, we all do. So skiing, snowboarding, climbing, what have you, or lifting. So this is something that's extremely important to me, where PRP, stem cells, as well as the therapy aspect of it, is allowed me to maintain my own healthy, active lifestyle. So let's introduce Jimmy. So Jimmy Westover, I've known him going back several years now. We've worked pretty close together, both on a personal as well as a professional level. So Jimmy, go ahead and introduce yourself.
Yeah, so my name's Jimmy Westover, James Westover. As Dr. Markle said, I'm a chiropractor, but I definitely function a lot different than a lot of other chiropractors. That kind of the rehab side of things has always been like a passion of mine. So I've spent extensive amounts of time outside of school doing, continuing education, doing as much education as I can in the rehab world. So I kind of claim myself as kind of a non-surgical rehab specialist. I also own Back2Movement Sports Medicine. So we're a kind of a sports medicine chiropractic clinic here in Colorado. I'm also, before I went to school to become a DC, I was a strength and conditioning coach for a long time. So sports, strength and conditioning is in my blood. I've done it for a long time. And then just like Dr. Markle, I'm an avid athlete. And we were talking right before this so I actually don't have an ACL in my left knee at all. Tore it when I was a competitive snowboarder and kind of came back really fast and decided to go the non-surgical route. So ever since then, I've always been kind of a proponent to, it's not for everybody, but if you can find a non-surgical option for your ACL injury, then bada boom, bada bing. So that's me.
Perfect. So let's talk about your ACL. As Jimmy mentioned, that there are some patients out there that tear their ACLs that are able to function quite well without it. But what does an ACL do, and what is it? So if we look at this picture here, the one on the left here is an anatomical cadaver in this ligament. So this is your knee, your femur bone, or your thigh bone. And this is your shin bone down here. Your front is to the left, the back is to the right. And your ACL basically goes in the middle of your knee. It connects your femur bone to your shin bone, your tibia. It's one of your main ligaments of your knee. You've got about 4 different compartmental ligaments, one on the inside, one on the outside, 2 in the middle of your knee. And they help keep your knee together. These are sort of like the lug nuts. They hold your knee together, to allow your knee to move properly. But in addition to being a ligament of your knee, it's also what we call a proprioceptive organ, meaning it tells your body it has a direct connection to your nervous system. So it protects your knee as well. So it has the ability to sense if your knee is in a bad position and reflexively strengthen, contract your muscles like your quadriceps or your hamstrings to bring that knee position to a better position to protect your knee. So this is one of the huge aspects of an ACL. That's why ACL injuries are so profound sometimes in individuals, because not only are you destabilizing a joint, you're also losing the ability to protect your joint with that reflexive capability. And surgeons over the years have sort of looked at every different ligament to replace the ACL. They basically cannibalize your knee, utilizing every ligament around your knee to try to replace your ACL with. And this has worked out over the years. If we look at some of the research behind it, overall, patients tend to do well. So a good portion of them are able to return to their sport. The revision rate's pretty low. Infection rate being as high as 3% can be somewhat catastrophic for a knee if you do get an infection. But overall, outcomes have been well, and it's actually improving over the last probably 20 years or so. The bad news, and some of the things that sometimes orthopedic surgeons don't really explain to patients, is, well, there are some downsides. So if you take your hamstring graft, for instance, well, that hamstring will never be as strong as your other leg. As well as if you do a patella tendon graft, so a graft from the front part of your knee, about half of those patients, one of the biggest things from the rehabilitation standpoint is pain out of that graft site. They're taking half of your patella tendon, so a lot of times that'll scar down, become very inflamed, is very, very painful, because that tendon is now half the strength. And then we're talking about your meniscal damage. So this happens twofold. One, when they reconstruct your ACL, they can't create the perfect angle as your normal ACL, so it creates a little bit of wiggle room in that knee. That little bit of instability will start damaging things around your knee, such as the cushion in your meniscus. As well as once you lose that ACL, that reflexive proprioceptive mechanism, also you lose it. So that's why rehabilitation is so important, because your body loses that reflexive capability to help protect your knee unknowingly. So that creates some damage in your knee. And then having that ACL reconstructed, you lose a little bit of range of motion, so that functionality of your knee sometimes gets pretty limited. And lastly, you get a lot of atrophy, because the downtime from an ACL reconstruction is pretty good, allowing them to heal up the bone tunnels they create some atrophy that sometimes doesn't come back, or it's very difficult to get that back. And one of the biggest issues that they don't really talk about is post-traumatic arthritis. So this is about 80%. So 8 out of every 10 patients will eventually develop some arthritis because of an ACL reconstruction, because of the things I've just mentioned. That unfortunately, so a lot of 250,000 ACL reconstructions are done every year. And usually a lot of them are in that 15 to 30 range age-wise. So by the time they're 40, they could be a candidate for something way far worse, such as a knee replacement, something like that. So these are the things from a non-surgical specialty. We think it may be even better if we can to maybe preserve your ACL, repair it versus replace it. So over the years, from an interventionalist, basically needles, we've been able to precisely inject an ACL to try to get the ACL to heal naturally, combined with some physical therapy. And we've been doing this for about 15 years now. So we've taken a procedure and a surgery that was typically open, then has gone to more of an arthroscopic procedure. Now we can do the same thing, healing the ACL with just basically 2 needles in the knee. And here's a MRI before and after on the bottom right, where this is your ACL. You can see this black line is pretty wavy. It's got a lot of weight stuff in it. And then 6 months later, this guy's a lot darker, a lot straighter, a lot more stable. So over the years, and this is why our MRI review by one of myself or one of our colleagues is important, because if you look at the radiologist report, they usually are black and white. They usually tell you it's either torn or not torn. But after doing this for a long time, we realized that there are some high-grade partial tears that the radiologist sometimes just reports as full thickness tear. Then there's a full thickness tear that's what we call non-retracted, meaning it's fully torn, but everything's still sort of aligned. And then you have a full thickness tear that's retracted, meaning they're just 2 ends flopping in the wind. And we found that really these first 2 are the best responders to what we do. From a stem cells PRP perspective, we have the ability to inject that specifically. And if we look at how that injection takes place, we put the patient in this position we call hook line position. We do this under a live x-ray, or what we call fluoroscopy. We put 1 to 2 needles in the knee, and the ACL has 2 separate bundles of the ACL. And the utilization of contrast flow, so we put some dye in there to make sure we're getting the injection directly into it. We can see that dye strike out directly into the ACL to make sure we're getting every aspect of the ACL. Now, our clinic actually created this injection, invented it, and have been doing it for about 15 years now. And we've seen some pretty remarkable things from this. So if we look at before and after ACL pictures, so the one on the left here, we have a fully torn ACL, but again, I can still see the conduits of the ACL, so that's what we call a non-retracted tear. And if we look at the radiology report, again, they just said, yes, it's fully torn, because the radiologist is really just looking at, do they need surgery, or they don't need surgery, so they're answering the question for the orthopedic surgeon. And if we go to 6 months after the treatment, we can see this almost like a fully normal ACL. It's nice and dark, it's nice and straight. If we compare that to the neighboring posterior cruciate, or the PCL, they're very much similar in the darkness. So after doing this for a long time, we started researching and publishing our data. We started with a 10-patient case report that showed about 70–80% of these patients avoided the need for an ACL reconstruction. And then we went on to, I published just under 30 patients, and again, we saw just under that 80% aspects of patients. So 8 out of 10 patients, ideally, we might be able to prevent the need for a reconstruction. And now, most recently, we even went on to do a fully randomized controlled trial. So we did this fully funded in our clinic here in Colorado, where we took patients, randomized them to the physical therapy group, because see if anybody's like Dr. Westover, who is able to cope with their own mechanism. Some patients were able to, but those that weren't, we treated them with a stem cell injection. And again, we see right now we've got maybe 40 to 60% of them have gone through the full protocol. We can see a drastic improvement long-term wise, statistically significant, as well as we're seeing MRI still continues to see that waviness, torn ACL transition into a much more stable, normal ACL, as well as symptomatically patients are improving. So this has been vetted. We've done the research. We're probably the experts in treating non-surgical ACLs, but just doing stem cells isn't always the only thing that's needed. So that's why Jimmy is here to also talk about this, because when we're talking about the knee or any kind of orthopedic condition, there's multiple avenues that we consider. So we use what was called the SANS approach. So the SANS approach means, first and foremost, overall stability. You need a stable joint to allow it to function properly. So by treating the ACL, ideally we are able to maximize that environment, getting some more stability in the joint. In doing so, that protects the articulation. So protect the cartilage, harvest the cartilage, as well as your meniscus and everything else around it. But the other side of the story is that neuromuscular component of it that we treated. So while preserving the ACL, we preserve that proprioceptive mechanism to allow you to protect the knee. And then also this overall symmetry. Now these last two, the neuromuscular recruitment as well as the symmetry, while we can preserve that mechanism, it's been damaged and limited. So also working with a good physical therapist to actually re-educate your body how to move properly and strengthen the knee is critical, because long-term wise, maybe you had a movement mechanics that caused the ACL. You're just not moving properly, putting more stress, basically causing a chronic repetitive stress injury that eventually the ACL tore. So that's when someone like Jimmy can go through a good full evaluation and then come up with a strategic way to slowly improve your strength by not stressing your knee out as much as it should during that acute phase from a rehabilitation standpoint, and long-term wise continue to help your body function better and strengthen it to actually prevent maybe a re-injury in the future. So Jimmy, how about you go through some things you did with Josie?
Perfect. Yeah. So kind of going off of, your kind of approach, right? Building the stability, then the articulation, then working on that neuromuscular control. So when we're talking after an ACL injury, right? Or if somebody chose to do stem cell, there's a point where we need to get the knee strong, but we can't load it as if it wasn't injured. So one of the best ways that I've found, whether it's post-surgical or whether it's post-stem cell, is utilizing blood flow restriction. So like this is a blood flow restriction cuff. And what it is you're more or less restricting the blood flow, more or less the venous return from the limb that you're working on. And they've shown that it affects the other limb too and all of that fun stuff. But really what we use this for is in the early stages of rehab, we were able to increase the strength in Josie's knee without putting a ton of load through it. So here's a little quote from a research article showing that low load resistant exercise, so 20 to 30% of a 1 rep max, and low load aerobic exercise, you wouldn't expect to elicit any kind of response. But when combined with blood flow restriction, responded in increased muscle strength and hypertrophy. So we're increasing that size and the strength. So that's another common thing that you see, post injury. The muscle kind of goes into this guarded state and kind of protects it. So we utilize blood flow restriction to kind of build that up. And if we go to the next slide, we can kind of talk about how that works. So a little summary of like how it's working. So you can kind of see the first column is high intensity stuff and how it responds and kind of what it's doing. So, right, we can see like growth factors are increasing and growth is increasing and stuff like that. And then if we look at the far right-hand column, that is just the low intensity column. So that's low intensity training without any kind of blood flow restriction. So what you normally see in like early stage rehab. So, just gentle movement, gentle load, stuff like that. And then if you look in the middle column, that is what it was like with blood flow restriction. So it's really cool because we can get the muscle strong as the ligament helps or starts to regenerate. So it's kind of a perfect combo with stem cell, because as the stem cells are working to kind of regenerate that tendon, we can get everything around it super duper strong. And then if we go to the next part, so just like Dr. Markle said, right, that that proprioceptiveness or whatnot, finding the missing link. So, an ACL injury, Josie's happened not because of, a chronic overuse kind of thing or anything like that. But what we found in the rehab process is that there were other issues going on. And so a lot of times, a lot of people just focus on like, okay, well, we got to get the quad strong, we got to get the hamstring strong, and then you're good. But, my big thing is I like to look at the whole picture. So we realized that Josie's ability to stabilize through her sling, so like her anterior sling on her right side, just wasn't quite as strong as we wanted it to be. So as you can see in the picture on the left, if you're looking at the screen, that's like a rotational exercise, not only to increase that strength and proprioception at the knee, but also to work on her ability to control that motion, as she goes. And then the right side picture right there, that's working on, so we noticed, because Josie's an Olympic lifter, as soon as we started lifting, she started having this weird kind of shoulder drive issue, almost because she was using her injured leg almost too much. So we had to kind of try to balance that out. So right here, what we're doing is there's a kettlebell on the ground, and she was doing like bottoms up kettlebell presses while stabilizing. And that red band has like probably 100 pounds worth of resistance on it. So it's trying to pull her over. And so that was kind of one of the things that we really worked on there, is kind of finding that missing link. And I feel like that's where a lot of people kind of struggle, is because they'll go through kind of traditional treatment and they'll get their quad strong and they'll get their hamstring strong, which is great, which is super essential, but they kind of stop there. They never look a little bit deeper into, all right, now that we're doing better, how do you actually function at the sport that you care about? So that's a big thing that I really like to drive home.
And having this piece of the puzzle is definitely a huge help long-term wise, not just short-term for rehab, but long-term wise, and just someone helping, like someone who's highly competitive like Josie, doing all kinds of things, Olympic liftings, basketball, you have it. But this will help her long-term wise prevent injuries from shoulders to back to re-injuring her knee. Just making sure they have a good holistic approach, and a therapist similar to like yourself, Jimmy, that takes that holistic approach, full body mechanics, and can dissect it and give her some things to really work on long-term wise stability and really that neuromuscular control component.
Yeah. Well, and I mean, just like you said, right? When things get injured, right, you go into that guarded state. So it's super important to look at everything else too, because that was a traumatic event. The body's going to compensate in super weird ways that if you never look at it, like that could become an issue, down the road.
Oh yeah. So now let's talk about Josie a little bit. Josie, welcome. I appreciate you, your patience and sitting through this. Hopefully you learned a little something. But take us through your background, sort of how you injured it, and then your experience going forward.
Yeah, sure. So my ACL injury happened, it was a boating accident. So I was just tubing on a lake and flying off the tube and hitting the water on impact. I hurt my knee, and swimming around in the water, I know that I'd torn my ACL. I got up into this boat and just completely collapsed. Unfortunately, then the MRI results read that I had both a torn ACL and an MCL. And the immediate decision in my case was, I'm from Norway, so the decision was to fly back home, and what I thought would be just immediately get surgery, because I didn't know there were any other options. However, in that process, I was fortunate enough to be back in Colorado working, waiting for my ACL surgery, and got in contact with Dr. Markle. And well, the rest is history in terms of then ending up doing the stem cell treatment. But what's more fascinating perhaps is just the incredibly speedy recovery I had. And me now being back to both playing basketball actually in the pro league here in Norway, and also competing in weightlifting again. I probably, knowing from, I've already had 2 reconstructive ankle surgeries earlier in my basketball career, knowing that both of those were what are considered today, failed surgeries, and that all ligaments are retorn, and knowing how much I've struggled with this ankle, I was really concerned going into and having an ACL surgery. I'm already a really clumsy person, so just the concern for you know, going through an ACL surgery and then, you know, at the risk of re-tearing and also at the risk of not being able to play or compete in weightlifting at the level that I was doing, I started looking at all these other options. So originally it was just looking at if PRP would have been an option, and then thankfully the state of my ACL allowed a stem cell injection. And I'm probably, to this day, I'm probably sugarcoating this a little bit, but because I think it was a fairly easy procedure. I mean, I was certainly not doing great the day of, but I was really quickly back on my legs after a couple of days, and then going through all my rehab with Dr. Westover. I, you know, every week was just new milestone just in terms of what I was able to accomplish. And having my stem cell treatment done in, I believe it was October or November, this was in 2018, I was back competing in weightlifting on the weightlifting platform in April 2019, so just a few short months after, actually. And then looking a year later, I'm now back on the basketball court as well, with just super strong. My leg and my knee feels great, and competing at highest level here in Scandinavia. So that's in, you know, kind of the summary. That's my where I'm at today.
Yeah, that's something typically we see. Doing this for several years now, we see that we have the ability to, one, get patients back sooner, so to start the rehabilitation sooner, preventing that, basically the atrophy from developing too much, and then working with someone like Jimmy or a qualified therapist, really working on the strength mechanics. We've been able to see that we can get patients back sooner, as well as maintain their functional level and get them back to even sports. Josie is downplaying the fact that she is a highly competitive Olympic weightlifter, as well as now in the pro leagues of basketball. So these are highly demanding on her knees, and everything's been able to perform extremely well, and she's a hell of a strong lady. So she's been doing great, and this is something typically we've seen where patients that from soccer players, basketball players, gymnasts, skiers, being out in Colorado, as well as anybody else, we've been able to see them get back to basically a high level of athletics without the need for the surgery. As we highlighted earlier, that surgery does have some downsides. So ideally, if we can prevent the need for something like that, that's going to be our goal long-term wise. So now we'll open up to any questions. Anybody have questions for myself, Josie, or Dr. Westover? We're happy to take them. We have a few minutes here. So we'll wrap everything up this morning. But again, I really appreciate everybody joining in. And Josie, again, I really appreciate your time and taking the time.
Of course.
Great. And then if anybody has any questions whatsoever, again, feel free to reach out, email me directly or Dr. Westover, or you can reach out to social media, and we'll go from there. Take care. Appreciate it.
Awesome. Thanks, everybody.
Have a good day.
Bye.